Okay, dear students. So today our topic is pharmacology of antiarrhythmic drugs. So these are the group of drugs. So they are helpful for the treatment of the arrhythmia. And arrhythmia, it is the abnormal conditions related to the heart. So where the heart beats are abnormal, or the rhythm of the heart should be abnormal, a rhythm. So that condition was known as a arrhythmia. So here certain group of drugs, so they are helpful for the corrections of the arrhythmia, and such drugs are known as the antiarrhythmic drugs. So before, so dear students, the conducting system of heart means the generations of impulses along with transmissions of the impulses from SA node to the AV node. So this is the locations of AV node. Then AV bundle. So this is the locations of AV bundle. This is the locations of AV node. AV node, and this is the locations of the SA node. And these all are the Purkinje fibers. So these are the special cardiac cells. So those are involved in the conduction as well as generations of the impulses, and these impulses are nothing but action potential. So they are helpful for the working of the heart or contractions of the heart, and contractions of myocardiums or cardiac muscles. So due to conducting system, so then they are helpful for the pumping of the blood or to create the pressure on the blood. So that pressure is helpful for the movement of the blood from heart to the lungs and back to the heart, then it towards the various organs. That is the concluded the pulmonary circulations as well as the systemic circulation. So with the help of the conducting system only, so that action potential or electrical signal, they are transported. So here, so this is the locations of SA node. It is present in the opening of the superior vena cava. So SA node, so they having the special type of cells. So they always involved in the firing without need of the stimuli. So they always involved in the firings. So due to firing, so when the voltage membrane potential reaches to the certain levels, so then only it can causes the opening of the sodium channel. So that was known as the threshold potentials. If the threshold potential reaches in the SA node cells, SA node is nothing but group of the cells in the particular area. So when reaches the threshold about minus 90 millivolt, so then the sodium channels are open on the SA node cells. So due to opening of sodium channel, the sodium can accumulated or enter inside the SA node cells, then they are causes the positive environment. So that is known as the depolarizations. And depolarization is responsible for accumulations or entry and release of calcium. Calcium should be released from the sarcoplasmic reticulums or enter from the calcium channels. So that was depending upon the depolarization, and depolarization depending upon the accumulations of the sodium. So due to accumulations of sodium, the calciums can be enter or calcium can be accumulated. So this calcium is responsible for the generations of the action potential or electrical signals, and those signals from SA node, so they are reaches to the AV node through this pathway. So that is the first pathway, then as well as second, then third, then as well as the fourth. So this is the locations of the AV node. So here the action potentials, they are came from SA node to the AV node. It cover the all the musculatures of the artery. It means so that action potential was transported all or complete muscles of the both artery. So as the movement of action potential taken plus towards the AV node, so according to that only the muscles are contracted of the artery. So due to contractions of the atrial muscle, the blood can be pumped into the and ventricle. So this is known as the atrial systole. So that was depending upon the conductions of the action potential from SA node to the AV node. From the AV node, so that was reaches to the bundles. Okay, so this is the AV bundles. Then so they are reaches to the or enters towards the bottom, that is the effects of the heart. From the effects of the heart, so they can take the upper directions here. So as they take the upper direction, so with the help of the Purkinje fiber, so how the action potential move to upward, the same direction the muscles are start to the contract of the ventricle. So here the so as the action potential is move upward, so then the ventricle are start to contract from bottom to the up. So that was helpful for pumping of the blood from respective ventricle to the arteries. Maybe pulmonary artery from the right ventricle or from the left ventricle, that is the aorta or aortic artery. So like that, so that action potential can transmitted from SA node to AV node to AV bundle, and AV bundle to Purkinje fiber. So that was helpful for the contractions of the cardiac muscle, that was helpful for the pumping of the blood. This is the normal physiology. And in the normal physiology, the SA node can discharge the action potential. The rate is 100 per minute if it is normal. Then if it is abnormal due to any scar in the SA node, scar nothing but certain infractions in the SA node or inflammation in the SA node or any malfunction in SA node, or due to accumulations of more calcium or accumulations of more sodium, or to decrease the potassium level in the cells of the SA node. So on that time, so this rate was increases. Instead of 100, it was produces more than 100. If the rate is 100 per minute means, so on that time our heart rate is around 60 to 80. If the rate is more than 100, then gradually the heart rate is also increases. If it is more than abnormal, that is more than normal, so that condition was known as the arrhythmia. So arrhythmia is the a regular or irregular rhythm of the heartbeat where the heart rate is more than normal. So that condition was known as the arrhythmia. Arrhythmia is occurs due to abnormal functions of the SA node. So SA node functions was altered due to excess accumulations of sodium or excess accumulations of calcium, or to decrease the level of the potassium. So on that time the rate was increases, the heart rate is also increases. So that was responsible for to cause of the arrhythmia. Or in certain conditions, so instead of SA node, AV node is also produces the action potential. SA node produces 100 per minute and AV node is also produces the action potential in the same time. So on that time the double action potential, so they are reaches to the ventricles, then automatically the rate of contractions of the ventricle was increases, and as well as the heart rate was increases. So due to that only the arrhythmia can occurs, where the instead of SA node, the AV node or other part of the cardiac cells, so they are involved in the generations of action potential. So due to that, the more action potential was generated frequently, that was responsible for the to increase the heart rate. That is also one of the reason for to cause of the arrhythmia. So another reason is, so any inflammation or scar in the myocardiums, so that was take the longer time for reaching the action potential. So suppose here the here the scar is occurs, then this wave can take the longer time to reach the AV node. First wave reaches through this way and this way, and due to scar here inflammation, that can take the longer duration. So the longer durations, once again the more action potential was reaches to the AV node to the Purkinje. Like that the heart rate is increases due to any inflammations or infraction in the arterial muscles or ventricle muscle where the extra systole can be occurs. So that is also responsible for to cause of the arrhythmia. It means the arrhythmia is causes due to excess of sodium, excess of calcium, decrease the potassium level or any infractions, or the deficiency of the oxygen in the cardiac muscle. Then also the extra systole can be occur that was responsible for the to cause of the arrhythmia. And simple here treatment, if you want to correct the arrhythmia means you can correct the sodium level, you can correct the calcium level, or you can improve the potassium level by giving the supplement. So like that, those drugs, so they can decrease the sodium and decrease the calcium and improve the oxygen and improve the potassium supplements. So then such drugs are helpful for the management of the arrhythmia, are used as a anti-arrhythmic drug. So that's why before understanding of arrhythmia or anti-arrhythmic drug, you should be understand the mechanism of the conducting system of heart, or what are the components so they are required for the conducting of the heart. If you know very well, then in the home itself you should be prevent the arrhythmia, because by controlling the sodium calcium level or improving the potassium or oxygen supplement to the myocardiums. So regarding introductions of the arrhythmia or anti-arrhythmic drug, so arrhythmia is a problem, so that is the rate or rhythm of the heartbeat. So during the arrhythmia, the heartbeat are too fast or too slow or within, so they are irregularly. So that condition was known as the arrhythmia. So that is regarding the sign and symptoms, that is the tachycardia, that is increase the heart rate more than the normal heart rate. So that was one type of the arrhythmia, that is known as tachycardia, or bradycardia, to decrease the heart rate more than normal. So that condition was known as bradycardia. Bradycardia is also one type of the arrhythmia. Then as well as fainting, sudden loss of conscious, and immediately that was recover. Okay, suddenly that candidate was suffering from the loss of conscious, he cannot aware to the environment, and immediately without any treatment he can recover. So that is known as the fainting, and fainting is also one symptoms of the arrhythmia. If regularly fainting is occurs or loss of sudden conscious occurs, and immediately you can consult your doctors without any delay. Otherwise, you become the arrhythmic patients, or that candidate was become the arrhythmic candidate, arrhythmic patients. Then as well as another symptoms is a confusion. So due to increased heartbeat, so the cardiac output is not maintained adequate. Okay, so due to that, the oxygen supplement towards the organ was decreases towards the brain especially. Then that confusion can be occurs, or profuse sweating is present during the arrhythmia. If unnecessary sweating is occurs, even the environment was cold, still that candidate was suffering from the sweating, means that is sign and symptoms of the arrhythmia. Then shortness of the breath, there is a difficulty in the respiration, that is also sign and symptoms of the arrhythmia or pneumonia. Okay, so after your shortness of breath, you can go for the monitoring your heartbeat. If the heartbeat is normal, then that shortness of breath is related to the lung infection. If the heartbeat is abnormal, then you having the shortness of breath, so that indicates, so that candidate was suffering from the arrhythmia. The next one is the dizziness or mental clouding due to deficiency of oxygen and glucose towards the CNS or brain. So that person was suffering from the dizziness. So that is another sign and symptoms of the arrhythmia. So regarding the risk factors or causes, so the arrhythmia can causes due to myocardial hypoxia, that is the deficiency of the oxygen in the myocardium or in the cardiac muscle, that was responsible for to cause of the arrhythmia. Then as well as ischemia, once again deficiency of oxygen, or any trauma or any injury to the myocardium. So due to taken of the certain drugs, so they can damage the myocardium or epicardium, or due to entry of the microorganism in the body, so they are also damage the myocardium and epicardium, or any entry of the chemicals or entry of the free radicals from the polluted environment, are generated inside the body by consuming the fast food. So those are responsible to cause of the trauma, and trauma can damages or cause the infractions in the myocardium. So that infraction was responsible for to cause of the arrhythmia. Then other one is certain drugs, then as well as electrolyte imbalance. If in your food the electrolytes are imbalanced, then also the person was suffering from the arrhythmia. Then as well as that is the autonomic nervous system effect. If the system was more active, then also the person was suffering from the arrhythmia. For example, during the excitations or during the stress, the adrenaline noradrenaline level was increases, and these adrenaline noradrenaline, they are the main neurotransmitters for the ANS system. So due to that, they can increase the heartbeat. So that was responsible to cause of the atrial flutter, atrial fibrillation, or different type of the cardiac arrhythmia. So this is regarding the introductions of the arrhythmia. So here certain drugs are there. So they are helpful for to correct the rhythm of the heart or heartbeat, and such drugs are known as the antiarrhythmic drugs. So their main funda mechanism is, so they are improve the oxygen supply to the myocardium, and so they are improve the or balances the electrolytes, then as well as so they are correct the myocardial infractions. So regarding the drugs which are used for the treatment of the arrhythmia, so they are mainly classified into five class on the basis of their mechanism. The class 1 is a sodium channel blockers. So these sodium channel blockers once again sub-classified into three types, that is 1A, 1B, 1C, on the basis of these drug on potassium channels. First, their main mechanism is, so they are block the sodium channels, or they are restrict the entry of the sodium ion into the myocardium. So lack of sodium, the depolarization does not occur, and lack of depolarization, the action potential does not generate due to deficiency of the calcium. So like that, so these drugs, so they are control the extra systole or extra heart rate by downing the sodium entry or by blocking the sodium channels. And same sodium channel blockers, so they also have the effect on the potassium channel. On the basis of the effect on the potassium channels, so they once again sub-classified into three types, that is type 1A, 1B, 1C. So type 1A, so they are block the potassium channels. So due to blocking of potassium channel, so they are delay the generations of the next action potential. After repolarization only the depolarization is occurs, our next action potential was generated. And these sodium channel blocker, the class A, so they are block the potassium channels, and lack of potassium in here, so this phase was prolonged, that is the prolong of repolarization. So due to prolong of repolarization, the fourth phase or refractive period was delay. Then due to delay of this phase is also delay, that is the phase 0. So due to that, the rate of impulses or heart rate was decreases by prolonging the repolarization by blocking the potassium channel. That is the drugs like quinidine, procainamide. One side they block the depolarization by inhibiting the sodium channel, and as well as so they are block the potassium channel and prolong the repolarizations by inhibiting the entry of the potassium in the here. Then as well as then class B, that is the 1B, so they are known as the shortened repolarization. So these are lignocaine, phenytoin, tocainamide. So these drugs, so they are mainly opens the potassium channels. So due to opening of potassium channel, the membrane was stabilized or the myocardium was properly repolarized. So due to that, the proper heartbeat was produced. So according to situation, the doctor they are choose the 1A, 1B or 1C drug. So on the basis of the physiology of the blood or concentrations of the electrolytes in the blood. And second B drug they classified as 1B shortened repolarizations due to, so they are opens the potassium channel. And third category, that is 1C, so these drug they do not have any effect on the potassium channel. If they having means, so they will be having the little effects, and those are categorized the little effect on repolarization. Example is a encanamide, flecainamide and propofenol. So these are mainly block the sodium channel, but they having little effect on the potassium channels. And class B, so that is the class 2, those are known as the beta blockers. So that is the examples are propranolol, metoprolol, atenolol and esmolol. So these drugs, so they are mainly block the beta 1 because the beta 1 was present on the heart. So during the activations of ANS, it releases the noradrenaline or it releases the adrenaline. So these both two, so they acts on the beta 1 receptors on the heart and enhance the accumulations of calcium. So due to accumulations of calcium, the heart rate is increased. If it is abnormally more religious due to more activations of autonomic nervous system or autonomic flow, then more adrenaline was religious, and more released adrenaline, noradrenaline, so they are more act on the beta 1 receptor, then they cause the more accumulations of the calcium. So due to that, the heart rate was increases. So that increased heart rate more than normal is called as a arrhythmia or responsible for two cause of the arrhythmia. And here the beta blocker, they block the beta 1, and due to inactivations of beta 1 receptor by use of beta blocker, so the released adrenaline noradrenaline, they are failed to bind on the beta 1 receptors. So lack of binding on beta 1 receptor, they do not involve in to increase the heart rate. So like that, the beta blockers like propanol, metoprolol, atenolol and esmolol, so they are also helpful for the treatment of the arrhythmia by decreasing the heart rate, by decreasing the accumulations of calcium, by decreasing the cyclic AMP concentration, by blocking the beta 1 receptor. And other side beta blockers, so they are also helpful for treatment of the angina, hypertensions or many other disorders. But here, so they are helpful for treatment of the extrasystoles or arrhythmia. Then class 3, so these are known as the potassium channel blocker, that is the amidorons and sotalol. So these drugs, so they are block the potassium channel, then so they can prolong the repolarization. So due to increase the repolarization, so there is a delay in the generations of the next potential, because this phase completion after only the phase 4 and phase 0 is occurs. Okay, so but without completions of phase 3, the phase 4 does not occur, that is the hyperpolarization. And without hyperpolarization, the phase 0 is does not occur, that is depolarization. And without depolarization, the phase 1 phase 2 do not occur, and due to that, the delay occurs in the generations of the next action potential or next heartbeat. So this phenomena was also helpful for to decrease the increased heart rate or rhythm of the heart by use of the potassium channel blockers like a, that is the amidorons and as well as the sotolols. And class 4, so these are known as the calcium channel blockers. So already you know the calcium is only responsible for two cause of the generations of action potential as well as the conductions of action potential from SA node to AV node to AV bundle to Purkinje fiber, that was also depending upon the calcium, and that calcium was enter in the myocardiums or cardiac muscle with the help of the calcium channels or from the sarcoplasmic reticulums. And here the calcium channel blocker, they block the calcium channels, and due to that they block the entry of the calciums inside the myocardium or cardiac cell. Due to that, they are decreases the concentrations of calciums in the cardiac cells. Then they are helpful for to correct the heartbeat and treat the cardiac arrhythmia. Examples are the verapamil and as well as the dilatism. So these are more popular drug. So they are block the calcium channel, then they are block the entry of the calciums inside the cardiac cell, then they are as well as in the SC node, then they are inhibit the firing capacity of SC node as well as they are inhibit the conductions of impulses from SI node to AV node to the AV bundle to the Purkinje effect. So like that, so they are decreased heart rate due to this phenomena. So they are commonly are helpful for the treatment of the arrhythmia, and these drugs are also known as a CCB, that is calcium channel blockers. Nothing but, so these are block the calcium. Examples are verapamil and as well as the dilatizens. Then next class, that is a class 5. So these are known as the other drugs. Example is a adenosine. So this adenosine, it can mainly blocks the AV conductions. Okay, so that AV conduction is required for the conductions of impulses from artery to the ventricle. So AV node is only one site through which only the action potential or the current from artery to the ventricle they reaches through the AV node. If your AV node was blocked, then no action potential was reaches to the ventricles. If the action potential is not reaches ventricles, means the contractions of the ventricle was decreases. So to decrease the contractions of ventricle, automatically the heart rate was decreases. And here, so these adenosine drug, it can acts on the adenosine receptor and inhibit the AV conduction. So due to inhibitions of AV conduction, it can control the entry of systoles or entry of action potential from artery to the ventricle. So this phenomena was helpful for the treatment of the arrhythmia. And adenosine is also decrease the refractory period. So this is the fourth phase is the refractory period. That is the period between two systole or two contraction. So that period was known as the refractory period. So this is the refractory period. So this is a period before the generations of the next potential. Okay, and here, so these drug not decrease, so these drug are adenosine, it can increase the refractory period. So due to that, the next potential was generated in the delay time on the after some time. So due to delay in the generations of next action potential, then the heart rate is also decreases, because so there is the gap, there is a more gap between the action potential, then automatically the heart rate was decreases by increasing the refractory period and inhibiting the AV conduction by use of the adenosines. The next drug, that is the magnesium and potassium supplement. So this potassium supplement, it is helpful for the repolarization or proper relaxations of the cardiac muscle. If you giving more supplement, the muscles are more properly relaxed, then they are repair itself and they are prepare from the extra systole or extra action potential. They are develop the defense mechanism, or that process was helpful for the healing of the myocardium by giving the potassium supplement. And magnesium, administration of magnesium, it can act mainly on the sodium potassium ATPase, where it can control the sodium potassium ATPase. So due to that, it can inhibit the entry of the sodium, and as well as the magnesium is mainly blocks the sodium channel as well as potassium channel and as well as the calcium channel. So this phenomena is helpful for to correct the electrolyte imbalance, and due to electrolyte imbalance only the arrhythmia was occurs. By administrations of magnesium, it can correct the entry of sodium and entry of potassium or exist of potassium, and as well as release of calcium and entry of the calcium. So like that, so they are correct the electrolyte imbalance that was responsible for the arrhythmia. Due to that, the magnesium was helpful for the treatment of the cardiac arrhythmia. If you should be free from the cardiac arrhythmia, means you should be prefer the magnesium containing food, or you can advise to your parents or your neighbor or your friends or your patients, they can take the magnesium rich fruits or rich vegetables or rich foods. So they are helpful for to avoid the extra systole or extra heartbeat, because extra systole is also responsible to cause of the amnesia, loss of memory along with the arrhythmia. Okay, if occurs like that, means then you go for to search what are the foods, so they having the rich of magnesium, then you can prefer to them. then they are free from the arrhythmia, or they are free from the confusion, or they are free from the Alzheimer's disease or loss of the memory. So next one is the, that is the digitalis compounds. So these digitalis compound inhibit the, or indirectly inhibit the ANS outflow, or it can control the ANS, autonomic nervous system, especially sympathomimetic nervous system. Activations of sympathomimetic nervous systems are adenosine system that was responsible for to cause of the cardiac arrhythmia. And here digitalis compound indirectly it can decrease the centrally sympathetic outflow. So due to that, so they are helpful for to control the extrasystole or extra heart rate. Then they can correct the rhythm of the heartbeat. That phenomena by use of digitalis compound, they are helpful for the treatment of the cardiac arrhythmia. Then as well as, that is the atropine. So atropine is an anticholinergic drug. So administration of atropine, it can block the AV node, or it is also block the AV conductions, or it can decrease the AV conduction. So due to decrease AV conduction, the action potential do not reaches to the Purkinje fiber or ventricle. So like that, so these atropine are is also helpful for or used for the treatment of the arrhythmia. But atropine, it can cause the dryness of the lungs. So due to that, nowadays it is not used as the antiarrhythmic drug or used for the treatment of the asthma. Only it can cause the dryness of the lungs, but it was potent. It is helpful for the treatment of the bronchial asthma or congestion in the lungs or pulmonary, as well as it is helpful for treatment of asthma, but it can cause the dryness of the lungs. So due to that reason, nowadays the atropine it is not used. But the atropine, it is mainly employed for the treatment of the any poisoning. It is a standard antidote, or it is antidote for the various heavy metals or various organous poisonings or many others drug poisoning. So where the atropine is a antidote. Okay, so remaining we will be continuing the tomorrow, not tomorrow, in the next class.